Bariatric surgery is deeply misunderstood. Stay with me on this. The most common complaints I hear are regarding the radical nature of it and the bad outcomes associated with it. Let's unpack those for a second. First off, it's a misconception that surgery works through restriction. We now know that this is wrong. This has been disproven over multiple decades ago. It works by changing the physiology of the individual, the exact same way that medicines work. You benefit from surgery because of physiologic changes, not from shrinking of the stomach or so on. That's not how it works. This has been proven. It is affecting biology. And in terms of its radicalness, it's actually never been safer to have surgery. The risk of complication is low. The risk of passing away is low. It's never been safer. The technique has never been better. And people recover quickly. Many people are leaving same day or next day after surgery. Your risk of passing away is lower than having your gallbladder removed, your hip replaced, or your heart bypassed. It is actually the safest abdominal surgery type that we do today. Bariatric surgery is the safest abdominal procedure. End of story. People that get it live longer, and it's not even close. That data has been reproduced now for 40 years, and it's incredibly effective, okay? And we have data now going out to 40 years, following people 40 years after the initial surgery. And those were really antiquated surgical techniques, and they maintain a large amount of the benefit in the vast majority of cases. And I would argue the biggest benefit of surgery is that there's a legacy effect, that you benefit from the changes to your body and your biology in perpetuity for as long as the surgery remains in place, which for most people is the rest of their life. It's like signing up for Ozempic and you're guaranteed to get an Ozempic shot every week for the rest of your life. It just turns out it works better than Ozempic. So that's pretty amazing. You don't have to worry about drug access. You don't have to worry about affordability, especially if your insurance pays for it. You don't have to worry about any of those things. Once you qualify, you're good to go and you get to reap those benefits for the rest of your life.